I'm one of the trauma surgeons here. I practice trauma, emergency general surgery, as well as elective surgery, and I also attend in the intensive care unit. What appeals to me about working here is serving this patient population in the broadest sense, which is everything from elective general surgery to outrageous trauma. I also run a research lab here, which is one of the most phenomenal things about working in such a great city hospital. I'm also affiliated with an outstanding research university where we truly are operating on patients a night, and the next day we're in the lab trying to figure out how to do that better, how to save lives better, and how to understand the pathophysiology of the disease that we see from a scientific standpoint. So what we're trying to do in the lab and what our research is about is understanding what happens early after trauma and what we do as a medical community after trauma affects patients and causes them to either become the patient that heals and does well and walks out of the hospital, or becomes the patient in the end stage of their life, sick, with organs failing and infections in the intensive care unit weeks to months later. We see a constant influx of trauma and emergency surgery. I was on call last night and took care of many patients. I was up all night in the operating room, and lately it's a rare occasion when we have a slow night. Honestly, we pray for those nights and hope for a break every so often, but in reality it seems almost every night we're busy with a combination of emergency general surgery and trauma. And it sure seems anecdotally, and I think statistics would bear out, that we are getting busier from both a surgery and a trauma standpoint. I think that independent of the quality of the physical plant or the modernness of the hospital, at San Francisco General Hospital we do more with less. And what matters most is the commitment of the people here that take care of other people. San Francisco General is a hospital that works. It is quite literally a world-famous hospital, renowned for its trauma care, affiliated with a second-to-none world-class university. And San Francisco deserves a world-class hospital.